sanitizer, courtesy of the Department of Corrections here. And thank you all for joining us this afternoon. I am being joined today by Kathy Sifkin with the Grocers Association and Mark Quando, who's the Department of Banking and Finance. They're going to be talking here in a little bit. First of all, again, I just want to remind people, as I always do, folks, this is really, really important about the social distancing. We've talked about some of the things in the past with regard to if you're out enjoying the great weather, it's a great day today. Please continue to remember, you got to keep that 6 feet distance from other people. That you should not gather together in groups of more than 10 people. And of course, one of the things that is incredibly, incredibly important is that if you are an employer and somebody shows up to work for you and they are ill, they've got a new cough, they've got shortness of breath, they've got a fever, send them home. Now I know some employers are actually taking the temperatures of people before they're allowing them to come to work. That's one way that you can help make sure that people are following that guideline. And again, if you are one of those folks who has that fever, has that new cough, that because it's allergy season right now, and a lot of people are getting coughs and sneezes with the allergies, but this is something new. If it's that shortness of breath, that fever, if you have those type of symptoms, not only do you need to stay home, but everybody in your household needs to stay home, especially in those DHM areas. Okay, this is where we have community spread. We really need people where there's a DHM issued. If anybody in your household is displaying these flu-like symptoms, you all need to stay home. Don't go into a clinic, don't go into an emergency room until you have called ahead. Make sure you make an appointment so they can make sure they keep you isolated while they run the test to see if you have the regular flu or if you may be a candidate to get tested for the coronavirus. So again, I want to emphasize that again. Please, these social distancing measures are so important. We need everybody to participate. I think we had Martha Stoddard here yesterday talking about how we got a D on one of the social distancing things that had to do with cell phones and people moving around. We need to do better than that. We need to make sure that we are absolutely on top of this so that we slow the spread of the virus. We can see what happens in other states like New York where they were unaware that they had the virus. It grew before they could put their social distancing measures in place, and now they've got a lot of issues in New York. We want to make sure that does not happen here. The whole goal through all of our social distancing guidelines is to make sure that we don't have so many cases we overwhelm the hospital system. It's about preserving those hospital beds, ICU units, ventilators for the people who will need them when they get the coronavirus. And the people who will need them are primarily going to be older and have underlying health symptoms. So if you're older or if you have one of those underlying health symptoms, again, if you've got diabetes, heart disease, lung disease, something like that, diabetes, all that sort of stuff, you are at greater risk. So you should be taking more precautions. And again, folks, this is why we are taking all these social distancing guidelines. And we want to make sure that we're taking all the steps proper to be able to make sure we can take care of people that come to the hospital system. So, again, 6 feet distancing between you and everybody else. Stay away from people who are visibly sick. Cough into your elbow. Wash your hands often for 20 seconds at a time. These are the things, don't touch your eyes, your nose, your mouth. These are the things that will make sure we slow the spread of the virus. It's absolutely critical. So please, continue to practice these good social distancing guidelines. Yesterday, we issued two new DHM, two new directed health measures. One for South Heartland, which I think we mentioned yesterday in the press conference, but also Two Rivers as well, we issued a DHM for. So, and that's the area that includes Buffalo County, and about the total yesterday was 11 counties that were added to DHMs. And in addition, we're working one for North Central Public Health District. That is going to be the area of Cherry County, Antelope, Holt, Rock, Boyd, that kind of area, that part of Nebraska. So that is being worked on and will come out later this afternoon as well. So new DHM on the way. One of the things I wanted to talk about today is we've been getting a lot of questions about online notary. Some of you may recall that last year, the legislature passed LB 186, which allows for the Secretary of State to do online notary. So what this involves is either a combination of audio-visual means or software to be able to verify the person's identity, but allow them to do it remotely. So as you can imagine, again, when we're trying to really emphasize this social distancing, doing things remotely is a good thing. We want to promote that. And so I'm going to be issuing an executive order, actually I signed the executive order already, that will waive the deadline from doing it July 1st to allow the Secretary of State to move that up to today to be able to start doing that, assuming he can put all the other things in place. So we're not putting any limits on, like there were in the bill. We're waiving the statute that requires it to be done July 1st. It can be done immediately, subject to the Secretary of State being able to implement that. This is going to be important for realtors, people who have mortgages, banking and finance, insurance. It will be impactful for all those categories to give folks the opportunity to be able to do that remote online notary so that they don't have to come in face-to-face, do something in person. So again, another step we're taking to be able to help people do that social distancing. And again, I want to emphasize, do the social distancing. So that executive order is coming out today to be able to assist our folks in finance and all of our Nebraskans who are doing those types of legal transactions to be able to do an online notary. And then I'll have Director Quandl say a few things about that here in a moment. So actually, take it back. I'm going to go ahead and have you come up and talk about that right now. So come on, Director Quandl.
Yep. Thank you, Governor, and thanks for signing that executive order. Executive order, I think it's 2013 is one.
Losing track. We're doing a bunch of these.
Right. It has to do with a lot of different regulations, or a few different regulations dealing with financial institutions. And the one on online notaries was brought to my attention actually quite a few weeks ago by our financial institutions, who said that speeding up the implementation date for online notaries would greatly help them in their social distancing protocols. And so, of course, any of the relaxations on the regulations have no impact on prudential standards, on safety and soundness of our financial institutions in the state of Nebraska. That'll go on as before. The reason why these relaxations are taking place is so that our banks, our credit unions, our installment loan companies can meet the needs of their customers during the course of this public health emergency, so that they can focus on their customers. And so exactly what does it do? We have a requirement that banks, financial institutions have an outside audit by a CPA. They still have to be completed, but the time that they file them with the Department of Banking and Finance will be waived during the course of the emergency.
So just to be clear, Mark, these are additional things that are in the executive order as well.
That is correct. That is correct. And then also, too, there's an annual examination requirement for installment loan companies, too. They're still going to have to be examined by the Department of Banking and Finance. However, that annual requirement, we're given some flexibility on getting that done as quickly and as practicable as possible after the cessation of the emergency. And also, too, we have some regulations that require copies of paper documents to be filed with the department. We're waiving that, allowing them to be filed electronically, and also, too, if there's any payment attached to that, to be done by ACH. And so that's the sort of things, all in the spirit of helping banks, credit unions, installment loan companies focus on their customers during this time. So,
great.
Yep. Thank you, Governor.
All right. Thank you very much, Director Quandl. Along the lines of continued focus on social distancing, one of the things we want to remind people is that when they go to the store, they need to continue to practice social distancing there. Again, keeping that 6-foot distance from other shoppers. When you're standing in lines, keep 6-foot distance. Now, we've got a number of stores like Costco here in Lincoln that has done a wonderful job of putting tape down on the ground to keep customers separated. They have the folks that are working at their stores to make sure that customers are staying spread out within the store. They are wiping down the conveyor belt as between customers as it goes up to the food goes up to the checkout cash register, all those sort of things. Walmart is also taking steps as well to be able to make sure they're keeping both their customers and their employees safe. They ask people to remember, again, the 6-foot distance, the washing hands for 20 seconds, all that sort of thing. They're reminding folks, they're taking steps. It is so important, again, that if you are going to go out shopping, to remember that we are social distancing. We're trying to keep that physical distance, between people to slow the spread of the virus. So if you're going to go shopping, go by yourself. Don't make it a big family affair. Go for the things that you just need. And when you're in the store, keep your distance from other customers. Make sure that you're staying that 6-foot distance in the checkout line. All those sorts of things. So we want to remind people again that when you're going out to do this essential shopping, that you do it in a way that is going to be safe and healthy. And here today to talk a little bit more about that is Kathy Sifkin with the Grocery Association. She's going to talk about some of the things that her stores are doing to be able to help make sure we're keeping everybody healthy and safe. So Kathy, I'm going to turn it over to you.
Thank you, Governor. My name is Kathy Sifkin, and I'm the Executive Director of the Nebraska Grocery Industry Association. And I would like to thank Governor Ricketts for allowing me to share this information. I'd also like to thank the Governor, Mayor Stothert, and Mayor Gaylord Bair for their leadership as we work our way through this pandemic. Due to their actions and guidance, I believe that all Nebraskans are going to be safer. People need to listen to their messages and follow the guidelines that they have established within our communities and across the state, as each week will bring new challenges that we're going to have to figure out and find solutions for. Our challenge today, as the governor said, is social distancing. Each one of us has a role to play in keeping our families, our friends, and our communities safe. We're doing things in retail stores that will help our customers make good decisions that are based on the guidelines that our leadership has provided. Our customers need to take this issue very, very seriously. If you go to the grocery store and the parking lot is full, go home. Come back later when there aren't as many shoppers. Shop alone. Do not bring your family. Do not make this an event. Leave them home. Designate one shopper for your family. And that's for everyone's safety. Plan your trip. That means make a list. Plan your trip for the week. Only shop one time a week. Don't go every day. Shop with your eyes. Don't touch all the products in the store. Touch only the products that you intend to purchase. We know that the packaging is not a big issue with the coronavirus, and that the virus is not spread through the packaging. The virus is spread through the moisture droplets. But let's not take a chance. Let's try to keep everything as sanitized as we possibly can. Keep your social distance of 6 foot with both other customers and with our employees. Give everyone an opportunity to breathe their own air and not yours. If you are ill, stay home. Do not go out. Do not go grocery shopping. Ask someone to shop for you. As a matter of fact, just this morning, our church sent out 2 forms to the entire delegation. One form was, if you need someone to shop for you, fill this out, we'll match you up. The other form was, if you're able to shop, fill out this form, we'll match you up. There is help out there. There is assistance, and you need to look for it. Do not bring reusable bags or backpacks into the store. They could be contaminated. We don't want to take that chance. Do not stockpile. We've said this over and over again. There's plenty of food. Purchase what you need and leave some for your neighbors. Trucks replenish supplies at the store on a regular basis, and the flow of trucks will be constant. Those small stores in rural Nebraska who get normally, on average, 1 truck per week will continue to get a minimum of 1 truck per week. Stores that receive multiple trucks per day will continue to receive multiple trucks per day. The system is working. The pipeline is filling back up. There are a few items that you will where there's been a shortage, and you will start to see those items fill the shelves here within the next couple of weeks. And one of the things that I really want to point out is that the manufacturers have changed what they are manufacturing. And since the big issue has been toilet paper, I want to talk about toilet paper and explain what you will see when you go back into the stores as the supply ramps up. Manufacturers have become more efficient, and what they're doing is making one size of toilet paper, not 3 different sizes. So you're going to go into the store and you're going to see mega rolls. I'm not talking about the big wheels. I'm talking about the rolls that just barely fit on your home toilet paper roll. And the reason you'll see those is because they're more efficient and it's faster to produce those items and get them out to the stores to replenish those supplies. And most important out of everything is wash your hands more than you think you should. At every opportunity, wash your hands to prevent the spread. We also understand the need to control the number of customers in our stores. If customers won't follow the directions of our leadership, I can only assume that certain steps will be taken. And those steps are left up to our leaders in both our communities and to the government at the state level, or Governor Ricketts. But my point is, do what needs to be done so that other people don't have to make those decisions for you. We are all adults. We are all responsible as citizens of this state, and as individuals, we have to limit the contact with other people. Responsibility is everyone's job. Please do your part by following these recommendations and the guidance our governor and mayor and our mayors across the state are providing. We know that it is a stressful time for customers, for everyone, and we ask you to be nice to each other, be nice to fellow customers, fellow citizens, and the employees that are on the front line that are providing the food and the essentials that you need and that are on the shelves in those grocery stores, because we are really all in this together. Thank you.
Great, thank you very much, Kathy. I appreciate your message there, especially about, again, sending people out just one person, once a week, for the things you need, make a list, be efficient, keep your physical distance 6 feet from other people, all that. That's great advice for everybody. We all can be a part of slowing the spread of the virus. We can all be a part of that solution to flatten the curve. So please, take these common sense steps that Kathy was talking about with regard to when you go shopping and how you do it. A couple of other things I just want to talk about. There are a number of organizations out there that may have masks and other PPE. You may not need them all because of the changes that have gone on with regard to your business. I ask that if you have those spare masks, that you consider donating them to your local hospital, clinic, EMT, firefighters, law enforcement, somebody who comes in contact with the public on a daily basis. So please, if you have extra supplies out there, those extra masks and so forth, consider donating them. And I'm just reminded by this by a story I saw yesterday. It was about a state trooper in Minnesota, Trooper Schwartz, I think it was his name, who pulled over a doctor for speeding, and she was, and instead of writing her a speeding ticket, he gave her 5 N95 masks. So that's the kind of thing that we want people to be generous. Think about, is there somebody else who could be using that personal protective gear, especially our healthcare workers, our first responders. If you have those extra masks in whatever business you might be in, please consider donating them to those folks. Also, I want to take this opportunity to thank Coach Frost and Coach McDermott. They both recorded public service announcements to be able to remind people to practice this good, again, physical distancing, all the stuff we've been talking about here. Appreciate the help of those 2 great Nebraska coaches to be able to help make sure we get the word out to people about, hey, this is serious. We need to take it seriously. Please practice all those physical distancing, social distancing guidelines, good hygiene that we've talked about. Today is April 1st. Often that means today is the day rent is due. And so I encourage, again, landlords, please go talk to your banks about what kind of flexibility you might be able to get with them. If you've got the opportunity to check out the SBA loans, the Small Business Administration loans, look at that. That's another way that you can get liquidity. It also allows you to work with your banks to waive any previous SBA loans that you may have already had. So please work with the folks there. And then landlords also be mindful of renters. Renters are going to many times be impacted by this coronavirus. You may recall that I signed that executive order that waives the requirement that those evictions have to be processed within 14 days. I've pushed that off till after May 31st. That only applies, though, to people who are impacted by the coronavirus. It does not apply to people who may be engaged in criminal activity or vandalizing the units or so forth. But for anybody impacted by the coronavirus, it does defer it. Now, it doesn't mean that you can stop paying your rent. You still have to pay your rent, but it just defers that eviction notice. And of course, again, apply to the unemployment office. We have at our Department of Labor, there's those new systems from the CARES Act that was signed last week, new programs that cover people that were not traditionally covered. Again, if you're self-employed, a contract worker, work for a nonprofit, all these new categories of people are now eligible to collect unemployment benefits if you've been impacted by the coronavirus. So again, please do that to be able to help get you through these tough times. And along those lines of hiring, the state government is hiring. We are looking for people in the Department of Corrections, in our Department of Health and Human Services, and the Department of Veterans Affairs. So if you're interested in that, please go look us up and be able to just go to the Department of Labor's website or check out one of those departments' websites. You'll be able to find information on the types of jobs that are available out there. So the the state of Nebraska is hiring right now. And then finally, our Department of Agriculture has put out guidance with regard to sale barns. Again, these are businesses that are essential, but they have to continue to practice the same social distancing we're expecting every other business is doing, just like we talked about with Kathy and the grocers, all those stores. We're expecting folks at sale barns to do the same sort of thing. So if you've got an auction going on, remember that you have to practice that good social distancing. You can find that on the Nebraska Department of Agriculture's website. Go check that out. You can find it there. I think it's www.nda.gov/COVID-19. So go check that out. All right. So now those are kind of the reminders that I had for today. We're going to go ahead and now move into the questions and answers. We start again, as always, with the questions we received. First one is from Tyson Hervanik from KRGI. In regards to the concerns that Senator Hunt shared via Twitter about an hour ago that 40 evictions have been scheduled to occur today in Omaha, I'm wondering if the governor will be moving toward a more direct approach on landlords with some more regulatory restrictions when it comes to those evictions. Again, if you are being evicted because of a criminal charge or you're vandalizing the property, that has health and safety risks for the other tenants. So this is not intended, the executive order is not intended to ban all evictions in those specific instances. And what it does do is defer those hearings until after May 31st for people who have been impacted by the coronavirus. So it's very specific about people who have been impacted by this. But impact could be, I was laid off from my job, I was sick myself, I had to stay home and take care of kids because our schools are operating without children in them right now. So those are all reasons that you may be impacted by this and can get that deferral till after May 31st. From George Lobby from North Platte Bulletin. I'm not sure Governor Ricketts realized that Game and Parks state care impounds are still open. Please clarify it with him if you will and ask if he has any comments in view of that. Again, I think it's up to Game and Parks to manage this. I would remind everybody that if you are coming in from out of state and you're planning on using one of our park facilities, you are still subject to that 14-day quarantine. So I had a question about this with regard to the turkey permits, whether hunters who already had the permits could come back in the state. Are those hunters planning on quarantining for 14 days first before they go hunting? Because that's what they have to do. I think if people know that they have to quarantine 14 days before they come and use our Game and Parks websites, or our Game and Park camping sites, that will not be something that they would be interested in doing. So Game and Parks will need to work to make sure that that's happening. And then also, just again, if you're using one of our campsites and you're from the state of Nebraska, and you're not subject to that 14-day travel quarantine, you still have to practice good social distancing. All the things we were just talking about keeping your distance from other people and so forth. Jerry Oster, WNAX. The question is, are there any provisions for small rural hospitals like Lynch or Osmond to handle patient surge capacity? It wouldn't take too many extra patients to create a problem for them. So yesterday, we talked about the executive order that I did that waived the requirements, for example, for our critical care, critical access hospitals, that they be limited to 25 beds so they can expand beyond that. It limited some of the time restrictions they were under and how long they were caring for patients and so forth. That will help expand the capacity there. We also waived some of the licensing restrictions on the people they're hiring. And, if the facility has to be relicensed, it's pushed those off. All these things were meant to expand the capacity for all of our hospitals, but in particular do apply to our small rural hospitals as well. And then just one of the other questions I get asked about this is, what about hospitals that can't handle a particular patient? That happens today already. From the standpoint of this is not a new thing for hospitals, that if they have a patient they don't feel like they can handle with the folks they've got on site, they do make arrangements with other hospitals to transfer those patients to another hospital. And I expect that that same procedure will continue to go on for the coronavirus patients. Grant Schulte, Associated Press. For the governor, overall, how well are Nebraskans complying with the social distancing guidelines and the directed health measures? Are you able to say at this point whether it is making a difference? So again, just getting back to, I think it was Martha who said we got a D in one of those things. We're able to track that down. Folks, we got to do better. I have seen that Nebraskans, by and large, are paying attention to this, but we've got to do better. We've got to make sure that we're continuing to do that social distancing. This is something that we're going to be in for the entire month of April at least. So we've got to make sure right now is the time. If you look at some of the models out there, it shows that between the middle of April, end of April, early May, somewhere in that time frame, we're going to reach the peak here in Nebraska of the coronavirus spread. And yes, we are working to draw that out, slow it down. That will help us make sure we don't overwhelm the healthcare system, but we need everybody to participate in those social distancing guidelines, that social, physical distancing from one another. And is it working? Yes, it is working. If you looked over the last several days, while we have seen, we saw a jump in some of the cases that were testing positive go up. The last few days, it's popped around between 25. I think we might have a few more today, but it was 25, then 18, and then back up to 20, and then I think yesterday was 25. I think we're at 33 for today. Is that right, Dr. Anton?
I haven't seen the 12 o'clock report yet.
Yeah, but I think ballpark, I think that's about right. So the point is, it is having an impact. We are not seeing it turn into a geometric slope at this point in the state of Nebraska. That's the good news. We need to continue to stay focused on this so it does not happen. We need to make sure we're continuing to focus on those things because that is going to help make sure. Another way that we can measure this is before we were at about 5% of the high-risk cases we tested are testing positive for coronavirus. I think we're about 5.5% right now. So it's creeping up a little bit. Social distancing is working. We know that we got to do more. We want to continue to stay focused on this. So everybody, please continue to work on this. Something everybody can be a part of. This one's actually for Kathy from Grant Schulte again. Are customers following the social distancing guidelines in the grocery stores? Have your members had any problems with large crowds or people crowding in the aisles? Are they respecting the times that are supposed to be limited to elderly shoppers? Kathy, I'm going to turn that over to you.
So I don't talk to every member across the state, but I talk to a good number of them. And it appears that in the grocery stores, people are respecting the 6-foot social distancing, and they are, the older at-risk people have a tendency to come in early in the mornings. We have not had a problem of overcrowding in the grocery stores, and at any point in time where that becomes an issue, and I don't think it will because our stores are adopting various strategies to try to keep people apart from each other. They have markings on the store. They have plexiglass that separates people at the cash register so that even in those situations where you have to be within 6 foot, you are still protected. So we're not seeing that issue, but our grocers are really proactive and have been for several weeks because it's in our best interest to keep our employees safe and our customers safe.
Great, thank you, Kathy. And if I could just offer something else as well to, and I got my weekly call with the mayors this afternoon, so I'll be talking with them directly. But if you do see something like that, you can reach out to your local mayor. maybe have the mayor call the owner of the store or the manager of the store and just bring it up with them. Sometimes all it takes is a little bit of encouragement for somebody to be able to take steps to be able to change what they're doing and really help us comply with all these social guidelines, hygiene guidelines, social distancing, physical distancing. And then from Don Walton, the Lincoln Journal-Star, how much of your working day is devoted to the coronavirus now, and how often do you communicate with the Med Center? What worries or concerns you most? So really 100%, 110% of my day is taken up with coronavirus. That is all me and my team are focused on right now is the coronavirus. We are working to make sure that we're prepared to be able to handle this. We are focusing on the three key things of expanding PPE, doing more testing, and then making sure that we've got the hospital capacity to be able to handle the people who will need to do it. And that actually rolls into one of my concerns is we have to make sure that we have the capacity to be able to take care of the people who will need our help, especially in those ICU units, those intensive care units, and for ventilators. So this is where, again, every Nebraskan is critical in helping us make sure we can take care of those Nebraskans who will need to use those facilities, those intensive care units, is by practicing the social distancing, the social guidelines, the hygiene, washing your hands, all of that, all of us can participate in to be able to help make sure that we don't overwhelm our healthcare system. And that is what we have seen in Italy. We do not want to have that happen here. So that's our biggest concern, and that's what my team is 100% focused on at the state of Nebraska to be able to deal with. So with that, I'm going to go ahead and open to questions and answers for the folks who are here in the, oh, actually, Taylor, I'm going to go with you first because you have sometimes get text. You get any text from anybody?
William Padmore with KRVN has a question for Kathy. He says, will there only be mega rolls of toilet paper available statewide? And what actions could the state take if customers don't follow social distancing guidelines?
So with regard to, I'm sorry, who is that from again?
William Padmore with KLIN.
William Padmore, KLIN, has a questions about will only the jumbo toilet paper rolls be available? And then he also asked what additional steps can the state do if people are not following those guidelines? So Kathy, I'll turn that first part over to you.
There will be product available in the store. It may not be exactly what you want. I know that toilet paper is one of the items that they have reduced the number of SKUs. So,
And you might want to explain what a SKU is, because I don't think most people know that term.
I'm sorry, a SKU is a number that you have for each individual item in a grocery store. So they're going to, in the past, you would walk into a grocery store and you would see an entire aisle full of many different brands and many different sizes. You'll get some selection, but you will not see the selection that you had in the past until the pipeline fills up and there's enough product where they can go back to giving you a choice of those different products. And as far as what the government will do if grocery stores run into problems, I can't tell you what the government will do. That is Governor Ricketts' job, so I'm going to lob that one back to you.
That is fair. That is fair. So again, what I'm encouraging people to do is, again, if you're a mayor or a police chief that sees this is becoming a problem in one of your local stores, go talk to the owner, go talk to the manager, let them know. If they continue to create problems, you can contact my office directly. But in a place where we have a DHM issued, which is, again, gradually more and more of the state, that is a misdemeanor offense. And so you can be charged with a misdemeanor with regard to that. So this is serious. People do need to take it seriously.
We have a question from Julie Anderson at the World Herald. You had announced last week that Blue Cross Blue Shield had agreed to pay doctors the same rate for virtual visits. Do you know whether other insurance carriers in the state, such as United Healthcare and Medica, plan to do the same? If not, would you consider issuing an executive order requiring them to do so?
So Julie Anderson of the Omaha World Herald said last week we announced that Blue Cross Blue Shield was going to pay the same rate for doctors with regard to telehealth. And we thought that was absolutely fantastic. That is Blue Cross Blue Shield being a leader in this industry. So we really appreciate their leadership in working with doctors and other providers to be able to do that telehealth care, which is in demand by both doctors and patients. And then she said, oh, do I know of any other insurance companies that have followed suit with regard to that? And would I take any actions of the state if other insurance companies were not doing that? At this point, we're really encouraging insurance companies to do the right thing and be able to step up and be able to work with providers on how you're going to reimburse for telehealth so that we can make it fair for everybody. But Dr. Antone, I'm going to call you up to ask just the question about if you know any other insurance companies that have followed suit.
So as of last night, I received word that United Healthcare and Medica, some of the other private payers, do have the telehealth policy in place, but are not reimbursing at the in-person rates that Blue Cross Blue Shield stated they were going to do. So far, we haven't seen the other payers other than Blue Cross Blue Shield come through on that obligation.
Great, thanks, Dr. Antone, though we would highly encourage those other insurance companies to work out something to be fair to providers to be able to reimburse them for telehealth.
Martha Stoddard has a reader question. When will Nebraska be ramping up COVID-19 testing to get a realistic number of cases to the CDC and also for the safety and awareness of all citizens throughout Nebraska? The reader is in Saline County and says that people there are not taking social distancing seriously.
So the question was from Arthur Stoddard at the Omaha World Herald from a reader about testing here in Nebraska. The reader is from Saline County and that people there were not taking it seriously. And it's about ramping up testing. And again, we are working to expand the testing capacity. I will tell you, no governor in this country feels like they have the testing that they want to have in their state. Nobody feels like they're getting it. We have worked to expand the testing at the public health labs, so we're working to do that. We are working to expand. I know UNMC has been able to get some additional tests, so they're expanding testing. We're working with the private or the commercial testing labs to be able to do more there. I think yesterday we talked about we're getting about 200 a day now from the commercial labs. Is that about right?
Yes, and overall, we've been increasing about 50 results per day now for the last several days, over 350 back yesterday.
All right, so Dr. Antone tells me that we've been increasing the results by about 50 a day to over 350 yesterday. And again, what we're trying to do is gradually open this up so that we don't overwhelm the need, because there are still priorities of people that we want to make sure get tested. And that's the ones we've been talking about with regard to, of course, you have to go through a screen first to be tested for influenza A and influenza B. Are we still doing the respiratory panels right now, Dr. Antone?
It's left up to the discretion of the provider.
We're letting providers use their discretion whether or not they do the respiratory panel, so they can skip that step if they using their own discretion. And then, of course, it's have you been traveling overseas? Have you been traveling into domestically in places like New York or Seattle or San Francisco where we know we've got community spread? Or have you been in contact with somebody who we know also has the virus, because that's another high risk. So for those folks, that's who we're prioritizing, and then gradually expanding that out to our folks in the, our healthcare workers, our folks in nursing homes, law enforcement, and so forth. So we, obviously, there's no governor who feels like they've got all the testing. I was just on a call with the National Governors Association a couple hours ago, and I can tell you, no governor feels like they've got all the testing they want. We're continuing to work to be able to expand that testing, and we will do so as we've got the capacity.
Martha also has a question asking whether we're applying for any of the SNAP waivers for emergency allotments that are available.
So Martha's also asking a question with regard to the SNAP waivers. Are we applying for those that are also available? And I'm not familiar specifically with the things she's talking about, so Martha, we're going to have to be able to get back to you with regard to that question, because I don't know exactly if it was part of the CARES Act. We're doing a lot of work. That bill just got passed last week. That's almost a 900-page bill, so we're doing a lot of research on doing that. But if it's a separate issue that I'm not familiar with, we'll have to, again, we'll just have to run it down and get back to you. So Taylor, will you take a note till we get back to Martha on that?
We have a viewer question about an April Fool's joke that's going around social media. She says they're getting upset phone calls about a Facebook post where people are saying that you are telling people they have to repeat the same grade next year. Can you comment on that?
Sure. The question was from a viewer that there's a April Fool's joke going around that I'm telling people that kids are going to have to repeat their grade next year in school. I think we talked about this yesterday. That's absolutely not true. In fact, I know our schools and our superintendents, our educators, our teachers, the Commissioner for Education, everybody's working very, very hard to make sure that our school children are getting that education this school year, even though schools are not going to be, reopening again. We had this press conference on Friday where Commissioner Bloomstead talked about that schools will continue to operate without kids for the balance of the school year. But also that they're getting those kids ready to move on to the next grade next fall. So that is again, if you see something being sent around on a Facebook post of me saying kids are gonna have to repeat a grade, it's just absolutely not true.
Don Walton's audio cut out. He just wanted you to comment on what worries you most right now.
So Don Walton's audio cut out, so we're gonna repeat the question again, or repeat the answer again. What worries me most right now? Oh, actually, I think he also asked if I was in contact with UNMC. And the answer is, yeah, I talk to the folks at UNMC, if not daily, just about daily. And with regard to, my concerns, again, it's getting back to making sure that all Nebraskans are complying with our physical distancing, social distancing, good hygiene guidelines that we're putting out there with regard to washing your hands, don't touch your face, stay home if you're sick, everybody in your household stay home. Those are the sort of things that every Nebraskan can do to make sure we don't overwhelm the healthcare system. That is the biggest concern, is to make sure that we don't have too many people going to our hospitals and they're not able to get the care that they need to be able to deal with the coronavirus.
Grant Schulte is the reader question. Why don't the
Hey, wait, Grant already sent us some emails already. Why does he get to go again?
You have a reader that must be watching.
A reader that's watching. Okay, Grant. Grant Schulte of the AP.
Why don't the directed health measures include requesting that businesses send workers home if they're able to? The reader says her employer would send people home but isn't doing it.
So the question was, why doesn't the DHMs include requiring businesses to send people home if they're sick? We've been saying that for a long, long time. Certainly, if that's one of the things we have to consider, we will with regard to the DHMs. But hey, if you're an employer, please do not allow people to show up for work if they've got that new cough, shortness of breath, fever. Send them home. Absolutely. This seems like common sense. This shouldn't seem to be like something we have to put in a DHM. We've been saying this for, first of all, you should have been doing that anyway before we even had a health emergency. And especially now when we've got a health emergency, you should be doing this. So please, do that. Send people home when they're sick. All right, Taylor, did I run you out?
All the questions for that.
All right, great. Questions from our audience? Yeah, in the back.
There was an incident in Juliet, Illinois, where one of the corrections facilities had some sort of outbreak, and the medical facilities are starting to see those inmates at their facilities. Can you kind of comment on what you're doing, or what's happening here in the state to prevent any carrying it into the jail, so to speak?
Right, so the question was about Joliet, Illinois, where apparently the coronavirus got into one of the correctional facilities there, and what are we doing here at the state of Nebraska to prevent that? Scott Frakes has a whole plan, a contingency plan for how we're gonna operate under this. And part of it is we have, for example, several weeks ago, we shut down visitations. I know that's tough on the inmates to not be able to see friends and family, but that's what we're doing, is really cutting off all that interaction for people coming in and reducing that opportunity for people to be able to spread that virus into our correctional facilities. So that's one of the steps we'll be taking, and we're gonna have other steps that we'll be talking about as well as we're prepared to implement them. But Scott Frakes has got a plan for how we're gonna manage this all. Again, it is a concern for us to make sure, because we do have a concentrated population of people that we cannot just let out. So we are taking steps to make sure that we keep them isolated and away from other folks so that the virus doesn't get in there, and do our best job to prevent that. And there's some other things we're gonna be talking about down the road along those lines.
Is the staff been directed in any way or measure to make sure that they're also not the person contracting?
Yeah, so again, we're taking a lot of steps with educating our teammates with regard to that. I mean, this is all part of what Scott's doing to make sure that we don't bring in the coronavirus into our correctional facilities. Yeah, Paul.
You get a lot of questions about tests, and now we're at 350 a day. What number does it have to be to give you guys comfort that you're doing enough testing to tell how many?
So the question from Paul at Paul Hamilton, Omaha World Herald was, how much testing do you have to do to be able to make sure you're doing enough? And ultimately, where I think this has to go, I mean, we want to continue to expand testing. We're going to continue to focus on those high-risk folks. And again, our plan all considers that. Our plan anticipated that we would not have the type of testing that we wanted to have to test everybody in the population, or even do a random sample of people in the population. So if you want to know the true spread of the virus in the community, you'd have to be able to do a random sample of people, Paul, to be able to know, get enough of a sample size to be representative of that area. Again, randomly selected people to be able to know that. So we don't have a number that we can give you right now, Paul, on that. And I think at some point, really, what we also want to get to is people who want to be able to get tested will, to be able to allow them to be able to do that. I think we're months away from that kind of capability to be able to do that. Right now, we are limited with what we can buy right now in the open marketplace and what we can get from the federal government. So those are the things, we're pursuing on expanding both of those. We're trying to buy more. We're working with our public health labs to be able to expand their capacity. We're working with the federal government to be able to get more testing and new regimes. And I think you will see companies stand up and do more. I was talking to the CEO of BD. He said that 30 days from now, they're going to be ready to start rolling out one of their tests. So I think you're going to see more testing come down the pike. But right now, I can't give you a number of what that number is. I just know we want to do more. Fred Knapp, yeah, NET.
Is the Department of Health and Human Services getting involved in deciding where the patients from a situation like the nursing home in Blair go, and what would happen in a small rural community if there were excess cases that couldn't be handled by the local hospitals? And
Yeah.
if so, what kind of criteria or thinking are they using?
So the question was, is the Department of Health and Human Services, and specifically Public Health, are they involved in the decisions with regard to something like what happens at Carter House in Blair when the residents need to be moved and what actions to take and that sort of thing, and about how to move it around and moving it around between hospitals and so forth? The answer is absolutely yes, and it's done in conjunction with the local public health department as well. And in fact, actually, Dr. Antone, if I could ask you to come up again and just talk a little bit about, maybe you want to give just a little bit about how the state worked with the local public health officials on that Carter House in Blair, and as an example of how this all works.
We've had some plans in place as far as what to do in situations like when there's an outbreak at like a long-term care or skilled nursing facility. And it includes, obviously, we were prepared for what happened at Carter House by utilizing what we had available at Midlands Hospital and St. Elizabeth's Hospital.
And actually, maybe, Doctor, you could talk about how you set that up ahead of time to be able to take that kind of capacity, too.
And that was exactly what was our plan. Our plan was to use those extra beds that those facilities renovated for us and got prepared for us for that particular type of situation. And it was so good to see the cooperation we had from those hospitals, the CMOs, the CEOs that weekend. Now, that's obviously, we can't keep using hospital beds for that type of situation unless somebody's ill enough to require a hospital bed. And so we're working right now and trying to get the dormitory rooms ready at the University of Omaha, University of Lincoln, and University of Kearney, as well as working on implementing a plan to open up some of the hotel rooms in the larger metropolitan areas to help with that type of overload. And to even use those hotel rooms as maybe even a way to transfer patients from being inpatients at the hospital back into the hotels or dormitory rooms for their convalescence. So those plans are all in place right now.
Maybe you could talk a little bit, though, Doctor, about how you work specifically in Blair, how that whole process worked between the cooperation between the state and the local public health officials and Carter House and that sort of thing.
Yes, we received a call on, it's actually Saturday evening, about the concern there for what was happening at the Blair Carter House facility. And I can't tell you how hard the local public health director up there, Tara Ewing, worked to implement this plan, and how our team worked in public health division to implement transportation, to call the CMOs at the hospital. Again, they were very cooperative about accepting these patients, and how smoothly. I even went to the Midlands Hospital that next day and witnessed myself the cooperation we had from the staff on the floor that Midlands gave us for this type of situation. They were prepared, pleasant, almost excited in a way that they were able to help out. So I was totally thrilled with the way everybody handled the situation.
Dr. Antone, if I understood you correctly, you're considering using dorms for people as an who are sick, but as an alternative to hospitals?
Yeah, the question is are we going to use the dormitory rooms or the hotel rooms for the ill patients? The ill patients will still be hospitalized. This will mostly be patients that are recovered after hospitalization or that just need quarantine or isolation that are not ill.
So before we get into more detail, why don't we wait till we actually have our plans all worked together without that, and we'll give you more details as we're ready to go on that.
Before you interrupt, can I ask you a question just about what's holding back? We have a lot more testing capacity apparently. What's holding back the testing? Is it the kits? Is it the materials? What is it?
The question is what, even though we have mentioned before, we probably have the capacity to do around 700 or 800 tests per day if we did max out on the number of tests. And you're correct, it's the reagents right now. And we have a lot of reagents on order right now. Once we get those in, then we'll be able to expand that capacity beyond what we're doing now for, like the governor said, for healthcare workers, long-term care residents, the inpatients in the hospitals, which is we're starting to see a little bit more people coming in to rule in or rule out COVID disease. So we'll be using that expanded capacity for that. And then, like the governor says, at some point in time, hopefully, you can't imagine how many times we get emails that say, hey, use our test. It's going to give you your result in 15 minutes. I mean, we'll wait for that to happen. When that happens, that's when we'll be able to do that.
And actually, Dr. Antonio, so one of the things I think also is when you were working with public health officials, one of the things we did, we talked about this capacity and having the ability to be able to go do what I'll call surge testing, for lack of a better term, is that when we had the Carter House issue in Blair, what we wanted to do is make sure we got everybody tested and got that turned around quickly. When I say everybody, all the residents, all the healthcare workers. And again, that's one of the things that we want to make sure that we don't overwhelm what we're doing with regard to our testing, so we have that capacity when we have something like what we had to do at Carter House to be able to make sure we can test everybody who needs to get tested in a rapid manner.
We have two questions from Ryan at KGFW in Kearney.
So Ryan from KGFW and Kearney.
He wants to know if the governor, asked the governor when it has to come to deaths tracked in Nebraska, like for example, the first death when he was self-quarantined at home. If there's a confirmed case, why aren't they being taken to the biocontainment unit? That's the first question.
So I guess I don't understand the question, Taylor. He said we're talking about deaths, why are they not being taken to the biocontainment unit if they are somebody like that?
Yep.
So again, I think that our hospitals are capable, and Dr. Anton, jump in up here if I say anything that goes wrong. But I think our hospitals are capable of taking care of people who have the coronavirus, even people who are severely ill with coronavirus. I might also point out, I think the capacity of the biocontainment facility is only going to be maybe 5 or 10 people. So not everybody who gets coronavirus is going to be taken care of. In fact, that really is reserved for, we had our patient one go there, but she had very severe, very severe disease and underlying health conditions, which is why she was taken care of there. But certainly we don't have the room to take everybody who gets coronavirus to be able to go to the biocontainment facility. Anything else you want to add to that?
I don't know all the details on that case, but I understand that he had flu-like symptoms, so to speak, and self-quarantined himself at home, self-isolated himself at home, and it wasn't even determined until after his death that he tested positive for COVID. So, but I would say over 90% of patients right now that have tested positive for COVID are self-isolating at home and not in a hospital setting. Only if they're ill enough for a hospital admission do they go to the hospital.
Here's another question. Is the statewide stay-at-home order in the near future for Nebraska?
So again, the question was about a statewide stay-at-home. Our plan does not call for a statewide stay-at-home order here in Nebraska. We are not planning on doing that.
A follow-up to that, though, Governor. On Sunday, Mayor Stothert and Dr. Poore, in their news conference, mostly went so far as admonishing some big box stores like Walmart, Sam's Club, Menards, as being overcrowded and not following the DHM. My understanding from you, is there anything, it doesn't sound like there's anything from your office that you can do to enforce it other than write a misdemeanor ticket? I mean, would it come to the extent of having the state patrol, kind of stake out these places is there anything you can do to work with the businesses? I mean, you're telling all the folks to keep your social distances, we all gotta do this, but what can you do from your office, from the state, for the businesses?
Yeah, so absolutely. When you're talking about, the question was about the mayor of Omaha had a press conference where she was telling the big box stores, hey, you can't get overcrowded, you have to follow all these rules. Again, that's part of the reason why we had Kathy here to talk about those rules that everybody should be following when they go shopping, but also the rules that, stores need to be following as well, that almost all of her grocers are following. And so when it comes to those stores, what I said earlier, is if you have those type of issues, the mayor should reach out to those store owners and those managers and talk to them directly first. Again, we're all in this together, folks. We don't need to bring down a big, heavy hand. Most people do the right thing if you just talk to them about it and give them a chance to do it. So that's the approach we want to start with. That's what the mayor of Omaha has done. She has reached out to those big box stores and talked to them about it and asked them to be more rigorous in how they are implementing social distancing kind of things in their store. We at the state can take further steps, but the first step is not to bring the hammer down right away. The first step is to actually go ask people to help be cooperative, work with us to be able to get comply. We can always go down the road with more severe sanctions, but the first thing to do, the easiest thing to do, is get that voluntary compliance from those big box stores.
We have time for a final question.
One more question. Yeah, Andrew.
You have the directive for people coming into the state going to game and parks. What about people coming on airplanes, on buses, and things like that?
Sure, so my direction with regard to people coming in from out of state is that if you come in from out of state, you have to go quarantine for 14 days. So yes, it applies if you're coming to go hunt or to go to game and parks, one of our parks. But if you're just coming in, say, for the Easter weekend, you gotta be here for 14 days before you can go out. So you're pretty much missed your opportunity at this point to be able to do that now. So everybody who's coming here, now this does not apply to people who are, say, those transportation workers, truckers, railroaders, people that are actually coming here to work, that kind of thing, who cross state boundaries regularly for their job. That does not apply to them. But if you are coming here because you're a returning snowbird, maybe you're down in Arizona or Florida, and you're coming back to Nebraska because the weather's starting to warm up here today. It's a beautiful day today. So yes, you have to quarantine for 14 days. If you're coming back from overseas, if you're coming back from any other part of the country, you gotta stay home for 14 days as part of that overall, hey, you're coming back. If you've got a cabin here, maybe you live out of state and you've got a cabin here in Nebraska, you have to quarantine for 14 days. So it's not just if you're coming back to use our park facility, it's everybody coming back here who's not specifically doing it with part of their job function has to quarantine.
Is that posted in the airports?
So in fact, we actually have it on our highways right now, that we are posting that everybody who's coming into the state, you'll see it, the signs we use for Amber Alerts. We've got it posted on the signs there as well, letting people know that when you're coming back in, you're driving back in, you got to quarantine for 14 days.
But job function is clear, people are traveling in and out of the state, or whatever.
Right.
for their job in there.
Right, if it's for your job, it's not, that doesn't fall in that same category. So again, if you're a trucker, you do not need to quarantine for 14 days every time you drive back into the state of Nebraska. This is specifically about people who are, those snowbirds returning, people coming here for their cabin, people are coming to visit, that sort of thing.
Or if you live in Omaha, work in Council Bluffs or South.
If you work in Omaha and live in Council Bluffs and vice versa, or South Sioux City, or maybe Scottsbluff and Cheyenne or something like that, those people are not subject to that quarantine. All right, Paul is cheating. He's asking for one more question here, Taylor.
Yeah, we have calls for you.
All right, I got a call with the mayor, so make it snappy, Paul. Let's go.
At one point you said stay-at-home orders are not, our plan does not call for that, but then you said, we don't need to bring down the big heavy hand. We don't wanna take further steps. Is there any scenario in which you would order a stay-at-home?
Paul, we're not considering stay-at-home orders because it's not part of our plan. We want to continue to get people to comply. We think we can do better. We all have to make sure we're taking care of our healthcare systems, so that we're, taking care to comply by these guidelines so that we don't overwhelm the healthcare system. But our plan so far is about taking the steps we are taking them early compared to other states like New York that have had to issue the kind of stay-at-home orders. They had different circumstances than we do.
So you plan so far, so it's out there, but you're just not considering it at this point.
We're not considering it, no. All right, folks, thank you very much. Again, I appreciate everybody coming here this afternoon. I appreciate the fact that you're rotating things around here. And folks, again, please comply with our social distancing guidelines, that physical distancing. This is how we can all make a difference in slowing down the spread of coronavirus, and this is how we will all get through this together. Talk to you again tomorrow. Thanks.
Did you test on that? Did you test on that?
Test?
Your COVID-19?
I've not been tested, so I don't,
I thought you were tested.
no, I don't fit the criteria.
Oh.
So I haven't had that shortness of breath or that cough or that fever.